Hello, this is Heather Bartlett, and I am the director of the University of Wisconsin Adult Congenital Heart Disease Fellowship Program. In a usual year, I'd get to spend about an hour going through all the details of our program with you, talk about the city, the institution, what it's like to live here. But this year we're doing that virtually, so I've cut down that talk to be a little more succinct. But please know you can contact me with any questions. I hope this provides a nice foundation, but it won't have all the details I typically have. So please contact me with any questions that come up. Thought I'd start with a little history about our program. The ACHD program was started in 1990 by Ford Ballantyne. The story goes that he was walking through the pediatric cardiology waiting room and he saw a 45-year-old woman with Epstein anomaly sitting there waiting to be roomed. He thought a 45-year-old probably would be better served in the adult hospital than the children's hospital, and so he built the ACHD program. UW Health prioritized further development of that program in 2012. I moved here in 2014, and Ford and I worked hard together to expand and further develop the program such that it received national accreditation as a comprehensive care center in 2018. We then turned our efforts to developing a fellowship program, and the ACGME accredited our ACHD fellowship program in fall of 2019. This is a picture of the faculty and staff for the adult congenital heart disease program. There's one key person missing here, and that's Sherry Rowland. She's the nurse coordinator for the program, and she is really quite essential. But she's pretty shy about getting her picture taken, so she's not listed here. The rest of the crew is posted. Top left is Ford Ballantyne. Again, he's who started this program back in 1990. Next is yours truly. Next is John Hokinson, who's been in Madison for a long time and used to work with Ford extensively alone, providing ACHD care before I came. We then recruited Luke Lamers to join the crew. He's a congenital interventionalist. He does all of our cardiac interventions, transcatheter interventions, and staff's clinic. Brianna Swanson is the ACHD nurse practitioner. She has a particular focus on wellness and transition. Jenna Torgeson is the electrophysiology nurse practitioner who provides a lot of our device and electrophysiology care. And then Nick Von Bergen is the congenital electrophysiologist. And we all work very closely together to provide care for this patient population. As I thought about our group, it really isn't just the 8 of us. We work very closely with cardiothoracic surgery and adult cardiology and pediatric cardiology and maternal fetal medicine. And once I started thinking about listing all those people, I thought I would drown you. So just know that this is sort of the central hinge point of the group, but the ACHD group is really much broader than this. And so I made this diagram to sort of characterize how the program works. The ACHD program sort of straddles pediatric cardiology and cardiovascular medicine. Administratively and physically, it is housed in cardiovascular medicine, but it has a lot of ties to pediatric cardiology. So I want to use this picture of the main campus to give you an overview of how the program runs. This is the central campus for UW Health hospitals and clinics. And if you look at this picture, at the bottom right of campus is the Veterans Administration. The building at the top right is the pharmacy school. The building at the top left is the medical school. And the building at the bottom left is our faculty offices. And right in the center is the flagship adult hospital called University Hospital. And I've outlined it in red here. It is where the majority of adult congenital heart disease patients receive care. And it is conveniently located right next to the Children's Hospital, which is circled in blue. In fact, it's connected on 3 levels. And so our clinic is located in the main cardiology clinic called Heart, Vascular, and Thoracic Center. It's under that star there. And the clinic is connected in a back hallway over to where the pediatric cardiology clinic is. So it's easy to bounce back and forth to run questions about images or casts or procedures by expert colleagues in congenital heart disease. It's also located right next to the echocardiography laboratory, where we have a core group of sonographers in the adult lab who have expertise in congenital heart disease. Post-op care occurs underneath the first yellow dot there in the cardiothoracic surgical ICU. And then the second yellow dot is where the cardiac inpatient wards are and the cardiac ICU are located. So the majority, nearly all of our inpatient and outpatient care occurs here. The procedures themselves, however, happen in the children's hospital. So the patient is coming in for an operation or a transcatheter pulmonary valve replacement. They'll come in through the front doors of the adult hospital. They'll be encountered into the pre-anesthesia care unit. They'll get their workup done and get all settled in for the procedure. And when it's time for the procedure, they'll be put on a gurney and pushed over to the children's hospital to either the operating room or the hybrid lab for their procedure. The procedure will happen there. And then when the procedure's done, the anesthesiologist will wheel them back either to the inpatient units or to the postoperative care unit if they're going to be discharged that same day. So all the pre-post care occurs in the university hospital, but the procedures themselves happen in the children's hospital. That's in part because of cohorting teams and expertise, as well as having OR time. So while most of your fellowship experience will happen on this campus, you will also go to a campus that's about a 15-minute drive or bike ride off your screen here to the bottom right, and that's to Meriter Hospital, which is the mother-baby hospital. So our pregnant patients with congenital heart disease, by and large, deliver at Meriter Hospital under the care of the maternal fetal medicine group. That hospital is staffed by UW faculty, and we work closely with that group and provide peripartum care over there. Every once in a while, an adult congenital patient will be admitted there if we don't have any beds at the main hospital, but that is our last resort option. So most of your care will happen here. There's one other site in the Madison area that we provide care. If you look at the lake there off to the far side, across the lake is another UW hospital called the American Center. It's affectionately called TAC. It has inpatient and outpatient services, and we staff outpatient congenital heart disease clinics over there as well. You can join in those clinics if you want, but the majority of your fellowship experience will be on this campus. Now here's some figures about UW Health, and I'm really just highlighting it here to show it's a busy place and lots of things happen. You don't need to know the numbers, but just know that it draws from a big area, and there is a large volume of experiences from which to learn. So there's 92 care locations, but almost 80 of those are throughout the region and not in Madison, outside of Madison. There's over 1,400 inpatient beds, over 6,500 inpatient admissions, 3 million outpatient visits, 200,000 emergency department visits. All the ICUs are represented. The ones you care about the most are the cardiac ICU and the cardiothoracic ICU, but you'll also go do consults in the neurosurgical ICU or the trauma and life support center, which is what most places call a medical ICU. There are 100,000 med flight transports a year, over 1,700 physicians, nearly 700 residents and fellows, almost 21,000 employees, and 1,700 volunteers. So there are a lot of people around to optimize your educational experience. And that's highlighted by recognition. So the University of Wisconsin is number 17 on the best hospitals honor roll for U.S. News and World Report nationally. It is the #1 hospital in Wisconsin. Nationally is number 25 for cardiology and cardiac surgery, and it's in the top 50 or the top 2% for multiple adult and children's specialties, and high performing in 9 procedures and conditions. Just to further emphasize this, other noteworthy accolades are that it's in the 50 top cardiovascular hospitals nationally by IBM Watson Health for the 10th time. It's one of 25 U.S. hospitals named in Newsweek's top 100 global list. In fact, it's number 14 among U.S. hospitals. It's the 3rd center in the U.S. to perform donor after cardiac death heart transplantation. It's a designated leader in LGBTQ healthcare equity by the Human Rights Campaign Foundation. The Department of Medicine is 5th in the nation for NIH funding. And the Wisconsin Alumni Research Foundation is 9th in the US for utility patents granted in 2019. And I just list these here to highlight that it is a center that is innovative and creative and driven for both equity and excellence in healthcare and research. This is reflected in the major programs in the hospital. There's a comprehensive stroke center, a level 1 trauma center that includes cardiovascular care, the Carbone Cancer Center, transplantation program, heart and vascular care, neurology and neurosurgery, and orthopedics and rehabilitation. Those are the major programs, and they really all support care for the adult congenital heart disease patients. So where are these patients seen? I sort of highlighted that in the picture before, but the names of the places are listed here. So the primary locations that you'll be experiencing are the University Hospital, which is the flagship adult hospital, the American Family Children's Hospital, which is the children's hospital, the American Center, that's the place called TAC on the other side of the lake. We also have clinics at Research Park, and the Cardiovascular Rehabilitation Center, which is on the west side of town. Meriter Hospital is the mother-baby hospital, and there's a clinic across the street from there that provides cardiovascular care. There's also the VA, which every once in a while we get a consult from. And then we do outreach at various locations from northern Illinois to northern Wisconsin. So here's a map of Wisconsin, and the red dots highlight outreach sites for cardiovascular medicine. Adult congenital heart disease in particular does outreach sites, and from the bottom of your screen at Rockford, Illinois, to the top right in Green Bay, to due north in Wausau. We do this to help facilitate access to care for patients who live further away from Madison. It's much appreciated and well received. And then this reflects where our patients come from. About half of them come from the area that we call the Ring, the greater metropolitan area. But then the hospitals surrounding that ring each contribute a significant amount of patients that we end up caring for. And then the rest of our patients come throughout the region, from northern Illinois to northern Wisconsin, and even once in a while, the Upper Peninsula of Michigan. Now, the cardiovascular medicine practice groups span all the subspecialties of cardiology. There's, of course, general cardiology for both inpatient and outpatient services, but then all the subspecialties are represented, and they're listed here, and then I kept adding more, and then I keep finding ones that I've missed listing. So just know that they're all represented. I listed adult congenital heart disease because not only is it alphabetical, but it's also my favorite, but there's cardio-oncology, echocardiography, electrophysiology, heart failure transplantation, and the list goes on. There isn't a subspecialty here that I can think of that we don't have a group that cares for that population. As I hope I've said before, I think our primary ACHD strength is collaboration. It's actually my favorite part of working here, is how friendly and helpful everybody is at caring for patients. I can reach out to anyone and they will chime in to help. The groups that I reach out to frequently, of course, are my colleagues in cardiovascular medicine and my colleagues in pediatric cardiology. My colleagues in cardiothoracic surgery, I think they call me more than anybody else, including my mother. Cardiovascular imaging and radiology, maternal fetal medicine, critical care, genetics, rehabilitation medicine, psychology, social work, nutrition, neurology, pediatric critical care, and neonatology. Yeah, because I need the neonatologist there when that mom's delivering. And all of these groups work beautifully together to provide high-end care, and I couldn't be more proud of them. And with that, the Adult Congenital Heart Disease Program has received its own accolades. So it is one of the ACHD accredited comprehensive care centers by the Adult Congenital Heart Association. It is a 3-star program by the Society of Thoracic Surgery for surgical outcomes, meaning it's in the top 5% in the country. And the cardiology and congenital heart disease, congenital heart surgery was ranked on the US News and World Report's honor roll for outcomes. So the clinical care is solid. The training environment, I think that's pretty solid too. So there's excellent infrastructure, and that largely is built off the strong infrastructure in the Department of Medicine and the cardiology core fellowship program. So the Department of Medicine has award-winning GME programs and just a nice attention to detail and robust policies and support mechanisms for trainees. There's a, hope I've emphasized well enough, there's a robust clinical volume here for people to learn from, and the faculty are motivated, dedicated teachers and mentors. So to give you an overview of the cardiovascular medicine fellowship programs, there are 15 cardiovascular medicine fellows. There are 2 interventional cardiology fellows, 2 electrophysiology fellows, 2 heart failure transplantation fellows, 1 ACHD fellow, and then we have a T32 training grant that allows a 1 or 2 year training program for research fellows. That complements 3 pediatric cardiology fellows to provide a nice group of trainees to work together and collaborate and help each other achieve their educational and career goals. To give you an idea of what the rotations are in the adult congenital heart disease fellowship, they're pretty prescribed by the ACGME. So in your first year, we have 5 adult congenital heart disease rotations. These are month-long blocks. And the ACHD rotation is a combination of inpatient and outpatient experience. You then have 2 months of what I call foundational rotations. And these are to complement your training coming in. So if you are a pediatric cardiologist, you will do 2 months of rotations in adult cardiology and medicine fields for both inpatient and outpatient care and consultation care. If you are an adult cardiologist, then those rotations will be in pediatric cardiology, pediatric critical care, genetics, transition medicine, just to complement your previous training. There are 2 months of imaging rotations, 1 month of cath lab rotation doing congenital heart disease caths, and 3 months of research. Your second year is pretty similar to the first. There's 4 months of ACHD rotation, 1 month of that foundation rotation, another month of imaging, a month in the cath lab again. This is the difference is there is a 1 month rotation in the cardiothoracic surgical ICU, where you focus on postoperative ICU care. And then 4 months of research to tie up your research project. Look at call and vacation. Call is home call. It's in week-long blocks. You start on Monday, you end on the next Monday morning, I guess. For a week block, it's home call. It is quite conducive to a balanced work and home life balance. You average 1 week a month. There are 15 work days of vacation per year and 5 work days per year of continuing medical education. Other benefits included annual educational stipend of $1,500. There's a $500 wellness stipend. You get dedicated workstations and office space. Through the library, there's free access to up-to-date CardioSource, Board Vitals, ECG Source. Senior fellows will have an additional 5 days off for job and or fellowship interviews. And yes, every once in a while, someone goes off to do yet another fellowship. The GME programs in general have had a strong focus on wellness initiatives over the past few years. And there's up to 6 weeks paid paternal leave for both parents. So for the curriculum, there are dozens of conferences and lectures you can learn from, but these are the core ones relevant to adult congenital heart disease. So on Tuesday, there's the CVM core curriculum, and then cardiovascular imaging and radiology. On Thursday mornings, there's grand rounds. There's pediatric grand rounds and cardiovascular medicine grand rounds. Those are at the same time, so I choose based on which one is more relevant to my current interests. That is followed by the ACHD core curriculum lecture. On Friday mornings, we have the congenital surgery conference, and that is followed by the pediatric cardiology core curriculum. And so this is an outline of the basic core curriculum, but again, there's the weekly research talk, weekly ECG talk, weekly imaging talk. There are at least 10 other lectures each week that you can go to if they're of interest to you. I encourage you to make use of all the educational opportunities around. There's also a host of research opportunities. So there's research opportunities in epidemiology, clinical trials, outcomes, as well as techniques such as vascular ultrasound or echo or ECG. And topics span the gamut of medical issues, which all have a tie into cardiology, such as smoking cessation, HIV, syncope, exercise physiology. You can do most anything you want here, and we will find you excellent mentors to do that. Let me tell you about the town. Madison, Wisconsin is a beautiful town. Bulk of it sits between these two big lakes here, and it has about 100 square miles of area. A fifth of that is water. The population of Madison itself is a little over 250,000, and the greater metropolitan area has over 650,000 people living here. Spend time on the terrace looking over Lake Mendota. Go to the farmer's market in the summer, watch the leaves change in the fall, or go to the festivals in the winter. There are outdoor activities year-round, and this is a place where people celebrate and enjoy Madison and Wisconsin year-round. There is always something to do here. Give you an idea of the demographics. The median age in the city is 31 years. About 17% of the population are children. 20% are between 18 and 24 years old. 30% are between 25 and 44 years old. So it's a young population. It is also a very educated population. So Madison ranks second in the nation in education. It has the highest number of PhDs per capita and has the third highest ratio of college graduates per capita. Madison is one of only 2 cities built on an isthmus. It's nestled between lakes Monona and Mendota. Madison is renowned for its beautiful four-season scenery. As I mentioned before, it has 5 area lakes. It has 12 public beaches, 15 dog parks, and is one of only 5 platinum-level bike cities in the US. There are bike trails throughout the city. It has over 260 parks and 200 plus miles of shared use trails and paths. And we have the Badgers. So it is a Big Ten research institution, and there's all of the cultural benefits of being at a university town. I can't think of very many places where I could see the top recording artist one night and then the national champions play the next night, and this is one of those towns. There's always something going on and something to do. And the Badgers have their set of traditions and songs and chants, and they're all about celebrating and enjoying life, and it is fun to be around that environment. So from all of us, welcome. I hope this overview of our program and the hospital and the city has been helpful. I'm really proud of this program and the people that I have the privilege to work with. And we hope you are interested in joining us. We're looking for folks who are intellectually curious and driven and who want to be excellent providers of adult congenital heart disease care. We work as a family and a close team, and we're looking for someone who wants to join our team. So please contact me with any questions. I look forward to talking to you further. I look forward to meeting with you. It'll be great. Please let me know if you have any questions. Thanks so much for your time. And again, my name is Heather Bartlett, and I look forward to meeting you in person. All right. Thank you.